the difference between squamous and glandular disease is really important. It's really a fundamental of how we talk about the disease now. So we don't really talk about ulcers per se, we talk about squamous versus glandular disease. So the horse's stomach is a big chamber, big single chamber, about 4 gallons. And the top half of that's lined by a squamous mucosa, which is effectively the same as our skin. And being a mucosa like our skin, it doesn't like acid. It has the unfortunate honor of living next to an acid factory, which is the glandular mucosa, which is the bottom half of the stomach. And that's much more like our stomach in that it's a complex mucosa and it's making acid. So when we talk about squamous disease, it's that acid splashing up from the bottom of the stomach where it normally belongs up to an area where it should have very limited exposure, and that increased exposure effectively causes a chemical burn. When we talk about glandular disease, it's much more complex. We're fairly poorly understood. We haven't been able to unpack it completely yet or even significantly yet. But what we think happens is there's a normal protective layer that lines the bottom of the stomach, and that layer breaks down, and then the acid can contact the tissue and equally cause a burn. But that distinction is really, really important because the causes are different, the treatment's different, and the preventative strategies are different. So it really drives the need for us to understand that it's a little bit more complex than just put in 1 or 2 words, gastric ulcer there, and actually being more specific and exact about what we're talking about in any given horse.